Hello, hello. Welcome to Flip Your Switch with Grace. I love it when you laugh. All right. Good evening, good morning, magandang umaga, magandang gabi in Philippines, konbanwa in Japanese, salamat petang in Malay, Singapore, Aywa in Irish, maayong gabi in, there's somebody's wanting to join, maayong gabi in Visaya, magandang umaga, or what's the Bicol of that? Oh my God, I forgot my own dialect. What's the Bicol? Who? All right, I skipped that one. So we have, welcome to this Flip with Your Switch with Grace episode. Our topic today is very, very important, cardiovascular disease and breathing exercise or techniques for COVID. This, I asked our speaker because I see the importance of this. I have like patients asking me, and as a therapist, I really don't know what to do. The breathing exercise. So I myself, I need this information. So let me introduce, myself. I'm Grace Burkal, physical therapist for 25 years here in USA. Also an autism specialist, studying functional medicine, photographer, a mom of 3, so on and so forth. But I'm here to welcome my friend Gina Lester. All right, just get a long name. BS, I don't know what it means, but RRT-ACCS, NPS, RPFT, Instructor for Respiratory Care at our local school here, an American Heart Instructor. And her goal has always been to improve the health and promote the well-being for people in the community. So that it is, he's an advocate for heart and lung health. I met Gina in a special, I worked with Gina before in one hospital. We connect. Why? Because we have the same laugh, loud and contagious. So I'm going to warn you, all right? Her laugh is so contagious that... See? All right. So with further delay, let me introduce our speaker, Miss Gina R. Lester. Take it away.
Oh, thank you, Grace. It's such a wonderful opportunity to just even be here with the few people that we have. But to me, cardiovascular health and just, breathing techniques, just things that we take for granted every single day, just every breath that we take, it should be an honor to all of us, but we take it for granted. And, even whenever we're faced with COVID or we're faced with the flu or some type of cardiovascular disease, we have to always remember how that we can repair the body, for healing. And Grace she's been so gracious and just been that person that's always wanted to improve the health and promote the well-being. I feel that just even being around her makes me want to even just be better, be a better teacher, or, to do more to help my community. And I think that's what she does. And if you go back to even if you look at the mission, the vision, and the values of the place of work that she works at ARH, you're going to find that that's their mission statement, to improve the health and to promote the well-being of people in Central Appalachia. And I'm so honored to be here. Just like I said before, I can't say it enough, but cardiovascular disease to me is, it all goes back to the heart. Cardio means heart. And then we talk about vascular is the vessels that lead to the heart. And I think about heart disease or people with high blood pressure or, just some type of heart disease that people are struggling with in our area. Just even with the COPD that patients face here in our community. So whenever we can improve, how well they breathe, to help them just breathe a little bit easier, I want to be a part of that. And I'm so glad to be here. But whenever I think about cardiovascular disease, I know that it's the number one killer of the people in the US. And that, every 90 seconds or 1,000 people per day actually collapse of sudden cardiac arrest that could be related to that cardiovascular disease. And it's so important to me because American Heart Association, their big motto is life is why, that we should learn more about heart health. Life is why. But see, you can remove the life and put my daughter is why it's important to me. Grace is why it is important to me. My community is why. My husband is why. My family is why it is important for every single person to make sure that they know a little bit more about heart health. Every person, even when I think about it, 400,000 people die of sudden cardiac arrest every single year. And 88% of that number happens to someone at home witnessed by a loved one. So the life that you save could be potentially somebody that you care about, somebody that you love, somebody in your own family. But whenever I think of that 400,000 people, I know that only 10% of that number survive if something happens and they had a cardiovascular event. 25 to 50% of somebody laying there unconscious related to some type of cardiovascular disease. 25 to 50% of them laying there, nobody's doing anything. So I want to make sure that we know the steps of what to do if something were to happen and somebody had a cardiac arrest or some type of cardiovascular event. Whenever we think of life is why, it builds longer, happier lives. It makes people, it helps people to be more educated about their health and how that they can promote the health and well-being of people, even in their family. More training, early detection, a world or a vision where no one dies from cardiac arrest or some type of cardiovascular disease. That's what gets me excited whenever I think about teaching and I think about education. To me, it is, how do we keep people out of the hospital? Grace knows that we are faced with so many COVID patients, so many patients with flu, so many COPD patients that do not know how to take care of themselves at home. So we're faced with, things, them not having a good diet at home, or them not taking the right vitamins, so that's why I think more of this, more of the things that Grace is doing is so needed in our area, because so many people don't have access to somebody to educate them, to, help them stay out of the hospital even more. But whenever I think about, how can we help maintain cardiovascular health? And it's having a good diet. It's taking the right vitamins or the right medication. Are they taking their blood pressure medicine for their high blood pressure? Are they making sure that their heart is healthy? And even if you think about it, taking a flu shot, and so many people are so against taking a flu shot, but believe it or not, that it can help actually improve your life. It can actually prevent a cardiovascular episode just by taking a flu shot every single year. And even it helps protect during pregnancy. Ladies that are pregnant, it helps them, reduces the chance by 40% of them just taking a flu shot every year. And even with, our kids, it decreases the chance by 74% of them just taking a flu shot. It helps prevent them from getting sick. And it also helps avoid stroke. Goes back to the cardiovascular disease that is the number one killer in the US. So I think it's so important that we take steps to actually help improve our health, our family's health, and even our kids. But, the big thing to me is, and I told Grace that I would send something, as far as how can we improve the chances of survival in these patients that actually collapse of sudden cardiac arrest. And if we do hands-only CPR, and I will post a video to Grace, that it will help guide you on the steps. Everybody most of the time carries a cell phone. So you just picking up and calling 911 is going to improve the chances of somebody, improve the chance of their survival. Other things that, I would want people to be, in tune with is breathing exercises. Grace asked me to help with breathing exercises. And whenever I think of breathing exercises, I think of just the ideal breathing pattern for any type of respiratory therapy treatment that we would give in a hospital. And like I said, a lot of people take it for granted, or, a lot of people have never really been faced with struggling to breathe, or, thinking of our COPD patients that struggle for every single breath that they take. And how can we conserve some of that oxygen, that they are blowing out so fast and so hard because they just feel like they are not going to, that they just can't breathe. And so they get scared. We all get scared when we're faced with anxiety of breathing or feeling like that we just can't get our breath. But the ideal breathing pattern for any patient would be just taking a slow, deep inhalation, or, from a resting exhalation, just a slow, deep breath in through your nose and kind of holding that breath. And it actually helps fill up the lung fields to where, that you're holding that breath in. So if you're taking any type of respiratory treatment at home, or breathing treatment, or an inhaler, that you're allowing that medicine to deposit into the lungs to where it needs to be. Whenever you hold that inspiratory pause for 1 to 3 seconds, then you allow that exhalation to occur. It doesn't have to be forceful. It doesn't have to be, you blowing everything out. It's just a normal exhalation. You're just kind of pursing the lips together to where that you're just blowing the air out. You can do that a couple of times to where it's a slow, deep inhalation. But if you get short of breath, even trying to do breathing exercises, then we would want you to pause and, maybe just take you a little break, and then take those slow, deep breaths in through the nose. And we do that. Why do we breathe through the nose? Does anybody know why we breathe through the nose first? Why do we breathe through the nose first, Grace?
Because that's the normal thing to do.
It is. It's the filter, right? So it's going to filter out all those toxins, all those things that are floating in the air. So that's our filter. So it filters out the air. It humidifies the air. So whenever we take that deep breath in through the nose, we're holding that breath, and it's going to allow or improve ventilation regardless of whatever therapy that we are doing. But that is the ideal breathing pattern for any type of respiratory treatment. But the thing is that when patients go home, even after COVID or some type of COPD, or, they are scared. They're scared of, their medication not working, or them running out of medication, or, it's all about education before they ever leave the hospital to know exactly what to do and how to take that medicine. So it's very important that upon discharge that our patients are more educated on how to do the therapies that the doctor has ordered. I think that's what a lot of the patients are brought right back to the hospital, is because, they're scared. They're unsure of, how to take care of themselves. And they end up coming right back into the hospital. So we're left with, all the time that it took to prepare them for discharge, they're right back in the hospital again. So we have to think about ways that we can be better educators actually in the hospital so that we don't see these patients coming back in and out of the hospital. Any questions so far?
Yes,
Does
Miss
anybody have
Gina,
anything?
I have a question. So breathe
Yes.
through your nose. How about the exhalation?
It's passive, Grace. It's just in through the nose. You're going to hold it for 1 to 3 seconds. And then exhalation should just be a normal exhalation. We can purse the lips together, which allows, more of a better oxygen conservator, especially with, COPD patients. They tend to, if they purse lip breathe, they, don't get as short of breath and are able to conserve a lot of energy just by purse lip breathing or doing some type of, breathing pattern that works best for them. If, even the patient positioning or coughing techniques, um, assisted coughing or certain techniques as far as coughing, patients get exhausted just from coughing, even with COVID. Some have a lot of secretions that still, it takes a long time to, for their lungs to get back to normal. But just sitting up, in a patient sitting up or, even having a couple of pillows behind them, it makes them feel better. It helps ease some of that shortness of breath that they may feel. One of the big things that I would like to talk about too is always put the affected lung up. The good lung is always going to be laying down. If you still like to lay down in your bed, but always make sure that that affected lung is up. You have better ventilation whenever you're kind of sleeping on the good lung, and it allows that bad lung for you to breathe just a little bit better just by the position that the patient is laying in as well. Purse lip breathing, like I said, is one of the another way that could help you conserve more oxygen. And diaphragmatic breathing is, something else that I would like to see in Grace that would actually help, conserve more oxygen than somebody using the accessory muscles to breathe. Once you start using those accessory muscles, you use up 50% of the oxygen that you have conserved. But if you have, diaphragmatic breathing or you're using better techniques to breathe, then you're only using 2% of the oxygen that you have conserved. Cough techniques, like I said, they allow, you to better achieve your goals as far as doing an effective cough instead of you just coughing and wearing yourself out. Another issue, as far as even cardiovascular health is, eating fruits and vegetables and being on a good diet, taking the right amount of vitamins. But carbohydrates actually make, even COPD or even patients that have a hard time breathing, it actually increases the carbon dioxide and makes you more sleepy. So if a person can eat more fats and more proteins, it's actually going to help a patient breathe a lot better. Any questions
So I have a
far?
question. I don't like to interrupt you, but
Yes. Oh, no, that's okay.
About a good lung. What do you mean by that? The good lung.
A good lung. Okay. Say that you have a pneumonia in one lung, say the right lung. You would always want that right lung up. The left lung would be you laying on the left side. Say that you like to sleep on your left side.
Mm-hmm.
If you sleep on that left side, then you would want that right lung up. It's going to allow for you to breathe a lot better. So I always say the affected lung up. It's going to be up off of the bed. So if, any type of breathing pattern as far as patient positioning, the patient sitting up, it's going to allow for, it's going to enhance oxygenation. And that's why that we would want it, that affected lung up, especially if you like to maybe lay on your right side and you have a right lower lobe pneumonia, or maybe you have, something going on that right side. Say you have a tumor or, whatever it may be. But it's always, a patient with even, say, COPD, they cannot lay down, or somebody that has congestive heart failure or some type of, cardiovascular disease. It's hard for that patient to lay flat. So it's better for them to maybe sit up. Even obese patients, them laying on their side, or, having a couple of pillows up under them, it helps with, so that they have a better time breathing.
Oh, okay. A follow-up question. Okay. That's
Yes.
if they know they had an x-ray. Okay. I have a case like where my sister can't go out because in the Philippines they're very strict. So this patient is just swab, no medical thing going on because some of these people can afford it. So
Oh, yeah.
if you don't know which bad what side of the lung, right or left, can
Yes.
you guide us if there's no x-ray, you have COVID, so what is the best position? I've heard prone position, like
Yes.
your bed.
Prone on.
Can you discuss on that one too?
Yes. Proning is going to enhance oxygenation as well, and it's going to help improve uh, the shortness of breath that you feel just by moving. I've heard so many patients, say even with COVID, that proning is the best because it actually helps with oxygenation. And that's the number one issue that patients face with COVID is not being able to improve oxygenation. And whenever a patient can't do that, we can only go up, so much on the oxygen before we have to put that patient on mechanical ventilation. And even with mechanical ventilation, proning has been able to, help keep the little air sacs in the lungs from collapsing. It helps improve ventilation. It helps improve oxygenation. So proning is a big thing. And I think even as a respiratory therapist, we are some of the unsung heroes as far as, being able to manage ventilator patients, knowing, all the different recruitment techniques as far as how do we recruit those little air sacs in the lungs? How do we make a patient that has COVID breathe just a little bit easier? And I think that's, what a respiratory therapist does, that we make sure that every patient just breathes just a little bit easier. And proning is one of those things to where that you're just laying, on your belly, because it takes all that pressure off the lungs to breathe.
How about sitting up? Like I learned this from physical therapy, the sitting and then this one.
Yes.
That help?
Yes, that's another one. Yes, that's a lot of times, you'll hear different tripoding or sitting up, leaning forward, especially if you have a lot of fluid on the lungs. Sitting up, leaning forward, you'll see that. So it does help improve ventilation and oxygenation, like I said. So it's finding that ideal breathing pattern that works best for, every patient, not just for one patient, because it may not work for, everybody's. And I think that's one of the main goals as far as educating patients upon discharge from a hospital or even at home. It's finding out what works best for them. How can we help them breathe? How can we get them back to doing the activities of daily living? How, what can we do? How can we help them to where they feel like getting up and getting a bath or making their bed or fixing them something to eat? So I think that's some of our goals, even as hospital workers, is that we make every patient feel, better about going home and taking care of themselves after COVID.
Wow, that's amazing. That's amazing information. So I'm right. Because I guided my sisters, and I just learned what I've learned from therapy about respiratory physical therapy. So I'm glad I did it right.
Yeah, proning and, just sitting up, like you said, leaning forward, just doing the ideal breathing technique as far as slow, deep inhalations, holding the breath, exhaling just passively. It shouldn't be forceful, just slow exhalations, not anything forceful.
Okay, I have some like patients that I've seen, and sometimes they have developed this anxiety. Can you tell me what to do or ask what to do when your patient's having anxiety and having a hyperventilation? What do you do?
Yes. And it's so hard because you have to consider everything about that patient. Even if I go back to COPD, because that's what we've been faced with for so many years, they deal with this every single day of their lives. And um, I think taking into consideration just the signs and symptoms, or asking them what makes you feel better. Is it a fan? Is it somebody just talking to you? Is it, me helping you do different breathing techniques, making sure that they're doing their therapies as prescribed. And I think that tells a lot about a patient is, we're in there for just a few minutes, or, maybe an hour for therapy, or 30 minutes, but we're not with that patient the other 23 hours during the day. And that's things that we have to take into consideration, what alleviates some of that shortness of breath. Because to me, to make a patient feel better, we have to know their signs and symptoms, as far as, what are they telling me? How are they feeling whenever they have to get up and use the restroom? Are they using more energy than what they have? And that's why their diet, making sure that they are eating healthy, they're getting the right vitamins, they're taking their medications as prescribed. I think it takes a lot of, us just really sitting down with that patient and really getting to know them, and trying to figure out how can we alleviate some of the things that they're telling us,
Okay.
that really makes them short of breath.
All right. With most of these viewers right now, they stayed at home. They actually not home, but they stayed in a hotel. What do you advise them aside from breathing exercise? Do you? I've heard this from a friend of mine who had a COVID when it was so bad in New York. I've heard about, she's a physical therapist, and she mentioned about monitoring your oxygen set. Can you tell us about it?
Um, with the oxygen saturation, you have to take into consideration as well. Do they have good perfusion? What's the color of their skin? Even, being an African American, it's going to actually affect the reading. Or do, they have cold hands and feet, So a lot of times it can give a patient more anxiety knowing what that oxygen saturation is, than it actually, helping them. So I've seen, even over the years, 20 some years, I've had patients to buy pulse oxes, or, to check their oxygen, and it not pick up, and so it can give them false readings. Nail polish, I wear black fingernail polish, so that's a big no-no. Even the lights, the lights in the room,
The
or
color of the
perfume.
nail polish?
Yes,
What
yes.
what
So it can actually
wow.
affect the reading. Mhm.
Really? Wow.
Yes.
I did
So
not.
there's a lot of things that can affect the reading, which gives these patients false readings, then gives them more anxiety, then sends them to the doctor because they're like, oh gosh, my oxygen saturation was really low. And, so I don't really recommend patients at home checking their oxygen, because,
So before
they
you,
are not the
I hear
professionals.
Jessica, she said, wow. She was like surprised too. So you would advise to take off this color.
Yes.
So what do you
Definitely.
what's the explanation for that? I'm just curious.
Oh, well, actually, whenever you do that, there's a light on that pulse ox that actually penetrates, so it gives up the reading. So whenever you have the nail polish on there, it actually blocks
Nice.
some of that.
Wow, because we've been checking a part of therapy when you exercise. So that's new. Thank you so much. I've learned that,
Yes.
hey, you there, patients, take off your nail polish.
Yeah, definitely take off. And that's why even with surgery, whenever you go into surgery, you see a lot of patients that will have one of their fingernails without nail polish on it. That's a big thing. Even in surgery, they, want all your nail polish off so that they're able to get a good reading. Even the lights in a hospital, the fluorescent lights can actually affect the reading. Movement, any type of movement
So do
you
you,
see,
okay.
moving your finger
Uh-huh.
can actually affect the reading as
So you
well.
suggest to turn off the light?
Sometimes, it can, especially if it's,
In light.
like the light is kind of beaming down on it. But, the biggest thing with the pulse ox, what I would want you all to understand, even as PT, is to make sure that the heart correlates, that you have a green light. There's usually a green light that kind of let you know that's a good reading. But if it's red, if the light is red, then that's a good indicator that it's not giving you the correct reading.
Wow. So, okay, we talk about the oxygen saturation. So what's the normal?
Normal is anywhere, but I always like to see equal to or greater than 92 up to 100%. But I don't never want to see 100% on a pulse ox, especially if a patient is on oxygen, because then I don't know what the oxygen in the blood would actually represent. So that's, one of the things that, a patient can have too much oxygen, which is bad for them because I consider oxygen to be a drug. So you have to be very careful, and especially with COPD patients. If they get short of breath, they think just by turning up the oxygen that it's going to help them breathe better, when it actually can actually be really bad for them. So don't ever go up, even with patients with COPD or, that have lung trouble. You got to be very cautious in giving oxygen to them.
So what level or what percentage do you really need to go to the hospital or call help? Especially
I would anything
with COVID staying at home. So what is the percentage that they really need help?
Whenever I think about it, Grace, I always do the 4, 5, 6, 7, 8, 9 rule. And I know as a respiratory therapist, I understand that. But anytime that the oxygen saturation that you put on the finger, once it starts getting below 90, then it means that the oxygen in the blood is getting low as well. So once that saturation gets even to 80% on the finger, then I would know that it is extremely low in the blood. So anything less than 88 would be an indicator that, the body's not getting enough oxygen.
Wow. So it's really important for those people that's staying at home with COVID to really monitor their oxygen saturation, pulse rate, heart rate, and everything. And
Yes.
do you think, blood pressure, we have to also,
With even with oxygen, to me, the heart is so sensitive, just like cardiovascular, the heart is so sensitive to changes in the body. So the heart rate is going to be the first sign that your body needs oxygen. If I were to go outside of my house and start running a marathon around my house, then the first thing that's going to increase is my heart rate, because it says my body needs more oxygen. And so I'm breathing deep and fast because my body needs more oxygen, but my heart rate would be that first thing that would increase to let me know that my body is not getting enough oxygen. So if my
So
This is
what's the range?
anytime that the heart rate is greater than, say, 100, it's tachycardic, right? So, I
So
always think if I feel my heart beating really fast and my oxygen saturation is low, that is not a good sign.
wow. So all right. There's I did this live. Jessica Cooper here. This she joined. She didn't join
Hi, Jessica.
she didn't join, but she has a question. Learn something
Okay.
new or gel polish? Is it clear? Like she's probably
No,
about gel
any polish that would be on the nail.
oh. So
Yeah.
take it
So
off, Jessica. Take it off.
gotta
Anything.
take it off,
How about
especially if you're
lotion?
lotion. No, it's more of that the polish on the nail, and especially any bright color, any reds or blacks or something like that that's going to actually cause false readings, and that's what we don't want. We don't want false readings. We want accurate readings. And I think that's why a lot of patients, even at home, if they have pulse oxes, that it causes a whole lot more anxiety as far as that patient being always, oh my God, my oxygen just dropped, and then a few minutes later, it's right back up. But that's the thing to me. We just have to be very cautious about who we give them to, especially if that patient already has anxiety. It just puts more added anxiety on that patient. So we definitely don't want that.
That's amazing. Okay, before I ask another question, we'd like to welcome those people in live watching. Rafaela Rizque from Philippines, Frances White from USA, Kristen Dan Vest from New York, Cheryl from Canada, Elizabeth MedTech, she's a MedTech, also a part of Life Advantage from Kentucky, Arlette from ARH, Miss Arlette. And Rosemary from Pikeville, McCoy. And I have my nurse also from sister who's practicing in Bicol. In Bicol,
Oh, okay.
she's a nurse. She is actually a hero because you know what? In the Philippines, nurse, they get paid, like, correct me if I'm wrong, maybe $5 to $10 a day.
Oh, that's
So
so
I tell her,
sad.
come on in, come on in. So she is very hardworking. So she is actually selling lettuce, organic food, just to make up with So, and Jessica Cooper. Our speech
Thank you,
therapist.
Jessica. Thank you, everybody.
What's up? Uh, and many more. All right, and we have also here Christina, whoever's in this room. I will see you, but anyway, I know it's getting longer, but this is getting interesting. So, a lot of questions, guys. Help me ask question. Type your questions, and I'm gonna read it. So, those people that's staying in a hospital. All right. Of course, you take care of them. What is the role of respiratory therapist? I know you're one our hero.
Oh,
That one.
well, to me, the role of the respiratory therapist is just to help somebody that's struggling to breathe, just to breathe just a little bit easier. A respiratory therapist, we deliver medication, we humidify gases to the airway, we deliver there's so much that a respiratory therapist does that, to me, whenever you add PT, you add doctors, you add nurses, we put this whole team together. I think we could help really educate the patient so that we keep more people at home and less people in the hospital, and just helping somebody breathe just a little bit easier. Me being an educator, the number one goal for me now is to teach my patients to, just to be good to people, just to, do their job and to do it well and to be educated, to always review, always be current on information that they're given to the patients, because that's what it's all about, just being able to breathe,
Wow.
breathe easier.
Wow. I get that, and like a lot of people watching my live. I'm so sorry, guys, but you can go Zoom. We will record it. It's recording. So, all right. Tell me about yourself.
Oh, well,
In 3 words, who is
in 3 words?
Yes, I know you have a lot to share, but in 3 words to summarize.
Just an advocate for better health. That's my motto, is to help people, to and I think life is why. If I had to sum it up in 3 words, my role is life is why, just to help people live another day, maybe to see their family another day, or to help prevent cardiovascular disease in my community. In the US, that is the #1 killer of the people in the US. I want to save more people. I want to learn something every day that's going to help me save more lives. I'm going to be a better educator, to help people like you, Grace, to be an educator of.
Thank you for doing this. Appreciate it. Thank you so much.
All right.
I love it. So, do you have anything like to promote, to whatever you want?
If the audience could do one thing, it would be to go online, or you can look it up, hands-only CPR. That would be the biggest thing that I could ever teach you. If you don't remember anything that I said today, just remember that just knowing how to do CPR could help save somebody that you love. Like I said, somebody dies of cardiac arrest every 90 seconds. And if I can help save more people, that's my #1 goal, is what can I do today to help save somebody, even today, tomorrow, or even in the future. And CPR to me is very special. And I did not realize how important life really is until I had a sick daughter. I worked in the hospital for 20 some years, and it really never dawned on me until I took my daughter into a hospital, and I worried about if they could save her if something were to happen to her in the hospital. That was my biggest concern, was will they be able to save my daughter if something happened to her? Would they know how to do CPR? And it's very basic, and it's not something people really think about until your family is faced with it. So whenever I think about life, I think about my family, I think about my daughter, I think about my son and my husband, and how that what I can do today can help somebody save somebody that they love. So it's very important to me. So hands-only CPR, if you do anything, make sure you learn the steps of how to save somebody's life.
Yes, actually, that's where I saw your potential. Miss Gina here is the one that's doing or training us with our CPR. And that's how I actually was impressed. I said, this girl knows something.
Well, it's what I like to do.
And you are so passionate. You are so passionate. And that's the reason I was thinking of this. Who's the speaker? Who's the speaker they're gonna invite? And #1 in my head is you, because I know I've seen you. You're educator. Tell me about your work right now.
Working at the hospital for over 20 some years, I was an educator. I worked in respiratory, but there's something about respiratory therapy to me that I don't know, it's my passion. whenever I think about it, I think about, even though I was an educator at a hospital, respiratory is my first love. It's the thing that I get excited about. I wake up thinking about it. I go to bed thinking about it. I think about how I can help my students, that I can help my community. But it's just one of those things, Grace, that just being a respiratory therapist, I had the opportunity to be able to teach at the local college. And one of my friends, she was my first boss when I got out of respiratory school. She called me up and asked me, she said, do you want to teach? And I said, well, I'd love to teach. And I was scared about doing it. But, when I think about all the people that I've helped over the years, there's just, there's no regrets. Wow. I do. I love my job. I love being at the college, and still I get to help with the hospital too. So it's just a win-win.
Yes.
And I still get to see people just like you.
Yes. That's
which is awesome
like
too.
He said, as always, I do some like success story. It's not really being successful is not where you are. It's the destination or the position. It's where you are doing things or creating things that could impact and help people.
Yes,
and I think are doing that. I hate you leave our air age and go somewhere, because you are one of the best lecturer and a friend, but I get to see you sometimes.
Yeah.
I really admire you. I really salute of what you're doing, and people like you inspires me too. And I know you're doing great. I know we have this special bonding because we are both moms of a special child, and that makes us both special. And even if we have struggles with families, we still do something for our community, and that makes us special with these people around us. And it's, I thank you for inspiring these people listening. I thank you for your time. I thank you for your precious moment. I know when I opened this, oh, is this my speaker? I thought it's like a famous actress here or model.
You're too kind, Grace.
So thank you so much. We appreciate your time and effort, and we love you.
Thank you, everybody.
Yes.